Hello everyone. This presentation is on Wu Ling San, also called 5-ingredient powder with poria. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Wu Ling San is classified under expel dampness. A representative pattern is Taeyang water accumulation with urinary difficulty, thirst, edema, headache or dizziness. Important ingredients include Zai, Fu Ling, Zhu Ling, Bai Zhu, Gui Zhai. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 66-year-old man with edema and hypertension. The current medicines are furosemide, lisinopril, metformin. This case gives a plausible reason to consider Wu Ling San, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is diuretic herbs plus furosemide. The mechanism is several ingredients promote urination, which can add to prescription diuresis. The clinical significance is moderate to high if dehydration, renal impairment, or electrolyte disturbance develops. My management plan is monitor weight, blood pressure, renal function, and electrolytes. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is fluid loss plus lisinopril. The mechanism is excess diuresis can lower blood pressure and reduce renal perfusion, especially with ACE inhibitors. The clinical significance is moderate in older adults or during acute illness. My management plan is monitor blood pressure and kidney function. Stop if dizzy or dehydrated. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Gui Zhai plus metformin. The mechanism is cinnamon-related compounds may lower glucose. The clinical significance is usually low to moderate. My management plan is monitor glucose during initiation and dose changes. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Wu Ling San may be reasonable when the patient's presentation matches Taeyang water accumulation with urinary difficulty, thirst, edema, headache or dizziness. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula List, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.